Nate Matthews Trigg to continue with our vulnerable populations moderation.
Yeah, great. Thanks, Christine. Good morning, everyone. So my name is Nate Matthews Trigg. I'm a board member of Healthy Climate New Mexico, and I'm really honored to introduce our next speakers who will be focusing on heat-related vulnerabilities. So to kick it off, I am pleased to turn it over to Dr. Robbie Parks from Columbia to discuss heat, mental health, and substance use. Robbie, you have the floor.
Hi, Nate. Thank you. I've shared my screen, so
Perfect.
I
Yep,
just
we can
want.
see it.
Okay, thank you. So, some wonderful talks so far, and very excited to present to today. So, I'm just going to be presenting about climate change, mental health, and substance use, and introduction to those sort of ideas and how they sort of relate to each other. Um, Yeah, so of course, probably going to hear a lot about climate-related exposures and health, but this sort of WHO diagram is fairly useful for trying to understand, you know, from sort of combustion of fossil fuels and the impacts that sort of have on exposures and modifying heat waves, modifying various environmental exposures such as wildfires and temperature, air quality, and how that interfaces with vulnerability factors you can see here. And in fact, healthcare resilience. And all of those sort of cascade really to the climate sensitive health risk, as you can see along the bottom. So that would include anything from direct impacts from, pressure on the cardiovascular system to direct and indirect impacts of mental and psychosocial health, and of course different sort of short to longer term impacts in general. So that's just to really frame everything. And of course, climate exposures could have impacts on large scale systems such as healthcare systems, but really they can also have a huge impact on the way that our body sort of operates, and that goes down to the sort of cellular and molecular level. And this was just a useful diagram, I think, to illustrate the fact that there are lots of different ways in which heat, for example, which I'll probably focus on with regards to substance and other related narcotics use here, and how that can really impact different parts of our um, uh, sorry, how it really can impact different parts of our bodily systems. And so thinking about it from a sort of large scale system to a sort of molecular system, I think really sort of will capture both the complication and the sort of widespread impact that climate is and has been having on our health. But of course, there's been mention of physical health and of course mental health. So this WHO sort of diagram, I think, is useful to sort of summarize exactly how exposure pathways from environmental exposures related to climate change can really have impacts on our mental and psychosocial outcomes. So here in particular, you've got stress reactions from, say, if your house was destroyed in a hurricane or a wildfire, and the strained social relationships that may imply mental health conditions, bringing about anxiety, depression, and then of course you've got alcohol and substance use here, and sort of the ability to cope with your environment and the changes that may be happening, both in terms of ambient and in terms of existential threats to our lives, are really modified by a lot of these vulnerability factors. And these are sort of key, really, in trying to understand and predict what may be happening with regards to health impacts after raised temperatures, wildfires, things like that. And so these key vulnerability factors, both within country, within state, within cities, but also internationally, those play a large role in the differential impacts in this case. In terms of sort of substance use, this is a key sort of paper that came out a few years ago, which really, I think, there's a lot going on, but really it's the same idea. So there's climate stresses, lots of different kinds of things. So storms, floods, heat waves, wildfires, ecological changes, shifted baselines over time, and how those exposures have a kind of health impact, really. And that profile can have impacts both direct and indirect. So this is sort of general sort of health, again, a health description of the connection between climate change and health outcomes. It can modify insect-borne vectors, school closures, can disrupt social networks, food shortages, and forced migration. And that in turn, really, you see the sort of risk pathways continued up here, where you can see that there is all of those factors can modify both the sort of biological as well as the social, psychosocial environment. And so those risk pathways can go into destabilization of psychosocial, environmental, economic, and geopolitical support systems, increasing rates of mental disorders and worsening symptoms, increasing physical burden, incremental harmful changes to behavioral patterns, negative emotional responses to anticipated and experienced harms. And all of that really results in not, in a deterministic way, but for people who are trying to use coping mechanisms and have maladaptive coping for many reasons. They don't necessarily have access to the right coping mechanisms. They don't necessarily have access to appropriate care. There is a risk of harmful substance use and relapse vulnerability. And so there is both a direct and indirect sort of relation here in how people would sort of link climate and climate-related exposures to substance use, both in terms of the efficacy of the substance and the potency of the substance, and the sort of indirect way that, as you can see here, that cascade of unfortunate events that are sort of social and socioeconomic result in the maladaptive coping. So both in an indirect and indirect way. And of course, there are adaptive actions. So these are sort of, really important in terms of how society can think of the capacity to both intervene and preliminarily adapt to prevent these kind of things being as bad as they could be. And that would include, primary prevention, secondary prevention. And so, the ways that people engender their lifestyle, and from a wider sort of intervention sense, how society would take care of its citizens in a long-term sense. The way that you might reduce harm and prevent relapse. And that, again, these are all complex links between social and sort of environmental sort of determinants here. And of course, one thing that should be noted is that a lot of people who are using maladaptive coping mechanisms in this environment are isolated, tend to be people who've got pre-existing mental and physical ailments. And so those treatments, when fires and temperatures, heat waves and floods and things like that occur, having the baseline risk lower by treating comorbidities in a timely fashion in a long time before these kind of things happen, really, would go a long way to sort of minimizing the way that people cope using harmful substance use in this case. And so one example of a study from a sort of scientific basis from a paper a few years ago was really looking at the association between temperature and alcohol and substance use visits in New York. And there's a lot going on really, but when you consider the temperature here, controlling for season, so of course, people will tend to drink in different ways, in the summer compared with the winter, but controlling for that, you can see that there is a sort of linear relationship between how temperature changes and people's propensity to end up in the hospital for alcohol. And so there is a strong sensitivity, in fact, up to sort of 20% from the lowest temperatures to the highest temperatures, And in fact, like with lots of mental health related conditions, it does tend to be linear or at least super linear. So it starts off linear, then levels off, as with other substances. And you can see that I won't show it here, but there are similar relationships for different types of psychoactive substances across the temperature spectrum. So that's in New York State. In nationally, there's also evidence with regards to substance use disorder. You can see different types of outcomes, but here, substance use disorder in general, again, nationally, a different but related study, you can see that there is a sort of almost linear relationship between temperature in the summer and the risk of hospitalization here. And just speaking to the wider impact of mental health, you can see that there are assault and suicide death rates increase over anomalously warm temperature days. And so the mental health impact is wide and beyond substance use, of course. And I just wanted to highlight, lived experience is so important for mental health and climate change. And this is Connecting Climate Minds. I encourage you to look that up if you can. It's about collecting lived experience worldwide from many different people in many different countries. And I was privileged to be able to be involved in that. And just finally, in terms of resilience, there's a critical gap in addressing mental health in heat health action plans worldwide. And you could see worldwide that the number of heat health action plans that we could find really is really concentrated in North America, Europe, and some places in South Asia, but really the global north mostly. And in fact, when you think about those intervention examples, many of them are not really addressing mental health, and very, very few are addressing substance use too. And if we think about the sort of concentric individual to societal level interventions that we can be making here, there are very, very few in the current key health action plans that really address mental health and substance use risk in elevated temperature. There's a lot of progress been made in general in physical health and preparation and warning systems, but much less so for mental health and substance use. And so, there's a big generalization of these vulnerable groups in these action plans. So, I'd be very interested to see progress and see what's happening in New Mexico with regards to mental health and heat health action plans and substance use and heat health action plans too. And so, climate exposures affect lots of different elements of human health, and substance use is one example, one key example of the mental health impacts. And there's really just a strong lack of both awareness and from a sort of, governance perspective, I think people know experientially that this is an issue, but in terms of actually factoring it into the way people govern and behave and make plans for this, I think there's a strong need for this. So thank you for your time, and I appreciate the invitation.
Great. Thank you so much, Robbie. That was very insightful. That research is stunning. Clearly, this is like an area that needs a lot more research and some really concrete interventions for especially people that use substances during heat events. One question for you, what would you recommend? What I've seen out there is pretty much a doubling down on kind of the low-hanging fruit harm reduction, like distributing Narcan at cooling shelters, recommending that people don't use substances alone. But I mean, do you think there's a real argument for like safe consumption sites that provide air conditioning, really going beyond what's currently available?
Yeah, that's a great question, Nate. I think, particularly with regards to heat, I think there's a strong need for acceptance that this is a heightened risk of using substances from a harm reduction perspective. If you understand that there's a greater threat to health under high temperatures, then providing the means to stay cool while using these substances in a safe environment, I think is a key way to sort of address this. Now, I think there's different ways, people tend to not necessarily want to be in a room with other people that they don't know when this happens. And so trying to understand how people can remain dignified while these coping mechanisms are used and the environment is kept cool, I think is a key question too, like retaining the dignity while and that goes for any heat health sort of action plan with cooling rooms and so on. But yes, absolutely.
Great. Thanks, Robbie.